Hey everybody. So I was doing some Googling and I wanted to really just study up on all these different prescription drugs and give you more of a detailed understanding of why they could potentially be very dangerous over time, especially if you are on a prescription drug therapy. But also too, why the holistic different supplements and detoxes and pills and powders and whatever are also just as dangerous. And then so you can differentiate and see why it is, and then understand the wording behind a lot of these descriptions of these drugs or natural remedies. Okay, so first you have to understand, synthetic versus natural. What does synthetic mean and what does natural mean? See, natural is being used as a way to differentiate and make it seem like it's better for you, but really natural is based upon the context. Okay, because there are natural remedies out there. When you look at natural, look at remedy, anything that's a remedy is a shortcut because it's not really getting to the root cause. It's a remedy. It do kind of a stay of execution, but it doesn't get to the root cause. And there's also side effects that happen. So when they say natural remedies, what is natural in the context of natural remedy? Well, natural is something that people would then assume using your own body as a natural remedy, like using your own body's chemicals and processes. Or what they look at or what they use out there in the holistic world is like, oh, instead of a lab created type of concoction chemical type of thing, you just go to your garden and you pick out the natural remedies like dandelion root, milk thistle, ashwagandha, anything that would seem like it's natural because it's a plant. Natural remedies are based upon plant therapies. But when you look at therapy, what is therapy? Therapy is utilizing and manipulating. First of all, it's manipulating your own immune system, circumventing it and manipulating it in a very unnatural way, I guess. And plant therapy is also taking poisons to manipulate your hormones to elicit a specific outcome. Okay. So when somebody says, oh, yeah, I'm all natural, that doesn't say anything. Everything on this earth is natural. Everything on this earth is made up of elements, positive, negative elements relative to how it affects the human body. Because everything of which we explain out there in the world when it comes to safety and comes to danger is based upon how it impacts you. So when someone says, oh, yeah, I do natural remedies, that should really be a red flag because remedy is attached and natural is just trying to differentiate between the lab versus out in your garden. But you know that there are poisonous bushes out there that you wouldn't necessarily go and use as a natural remedy because it's a natural, right? You wouldn't use poison oak to manage your symptoms. Okay, you wouldn't use poison oak, right? So you know that there are different levels of severity of poisons out there that are natural in your garden. So you wouldn't be using pyracantha berries because those are poisonous to the human body. They get birds drunk. So, I mean, that's natural. Pyracantha berries are natural. Uranium is natural too. Okay, but you're not going to be using large amounts of uranium to manage your cancer, disease, and chronic illness. So we have to really understand the meaning behind these words that are being used so you don't get snowed or fall into a manipulation because there's a specific intention going on. So with prescription drugs, okay, I've went over a couple days ago or yesterday. When you read about prescription drugs and why they have recalls, and you're like, well, why does the FDA approve of them to begin with? Okay, and then why do they get recalled down the road? So let me give you a real quick thing here. The body adapts. What they do in the allopathic and the holistic industry is they upset homeostasis for a minute. And they have a specific intention, which is to stop the pain or manipulate your hormones in such a way to have a specific outcome. So when you're going in and you are manipulating your hormones and you're trying to stop the pain, you are essentially blocking or circumventing the system's natural reaction to poisons. Okay? So the body is not supposed to have poisons. I mean, yeah, the body isn't supposed to take in poisons. Okay, so in the beginning, when you are taking a drug, and when whatever it is, if you were prescribed a drug and it's supposed to work for you in some way, and you do find some relief by taking a drug, what happens is that you're shocking your body into submission. You're blocking a specific hormone that aids in the healing process, like prostaglandin hormone, and then eventually, over time, the body is going to adapt because you are breaking the laws of your body, and you're going to be held accountable. And the body isn't going to want to just die, it's going to want to live. So guess what? The drug doesn't work anymore and the pain returns. Because when the body adapts to poisons, what it does is it creates antibodies to go after the poisons. And then the adaptive part of your immune system will then allow the pain to return because it wants to live. You can't prevent pathogens and you can't prevent healing. So pain is healing. So when you're taking a prescription drug or you're taking a holistic supplement or a holistic remedy detox, you are essentially poisoning your body. And so it creates antibodies. And then and then there's also other elements that target specific systems in your body to then manipulate things like blocking certain hormones or blocking like the immune system to create antibodies, or and let's say thinning your blood. That would be a specific duty of some specific drugs out there, like aspirin. It has a specific element that goes and thins your blood, so it stops the platelets and the white blood cell counts from agglutinating, so it doesn't thicken your blood. But then there's side effects. See, this is what happens when drugs get approved, like let's say well, right now there's a postpartum drug. Well, forget that for a minute. Let's just look at the blood pressure medicine, okay, or the blood thinning medicine that was just approved and then recalled. Their double-blind studies on all of their patients and all of their trials and everything, it worked for a certain amount of time, okay? So they found that there was some kind of temporary relief. Some bodies don't adapt faster than other bodies. Some bodies can take on poisons for a long period of time, manipulate their hormones, manipulate their systems, and they have some kind of short-term success. But what happens is when you see the side effects on all of these drugs is because eventually the body is going to adapt to that poison, and then the pain's going to return, but you don't escape the laws of the immune system in the body. When you're taking in a poison and it says that it's going, that it potentially could give you all these different diseases and different malfunctions, that's predicated upon eventually when your body does adapt to that drug, you're going to see the outcome. You're going to see the consequences of violating your body's body with poisons, and this is the outcome. You're going to have all these side effects. Okay, so what the pharmaceutical market is banking on is that there is enough time in between you taking the drug and before your body adapts, and they're trying to capitalize on that money. Not saying that's their intention, because you guys are looking for a relief. You're looking for short-term benefits. You're looking for that quick shortcut. So they're looking for and creating these quick shortcuts, but they don't anticipate at what point will your body adapt, and then the pain returns, and then you're still held accountable for taking in a poison. And that's with every single medication out there. Okay? And so no matter what, so when you read about, let me give you, and this stuff is kind of hard to explain because it's very intricate, because it has to do with science and pharmaceuticals and how the body adapts to poisons, and then also what things out there manipulate, like synthetic, like the horse hormones for pregnant mares. They're using that in some of these birth control drugs, okay? So like this, for instance, brexanolone injection quickly improves postpartum depression, okay? Well, what is it doing? What is this brexanolone doing? Okay, and I'm going to pull this up. But at some point, this is going to get recalled because they're going to see more side effects in the population to where now they have to pull it. But right now, it's in its first stages of where it's being introduced, which means that they're going to see successes, and then they're going to be like, people are going to come back and be like, oh my God, and here's what it is. So this is out of Barcelona, Spain. Brexanolone injection provides rapid and durable improvement in postpartum depression in an integrated analysis of 3 pivotal randomized trials collectively known as the Hummingbird Trials. Christine Clemson, PhD, reported at the annual Congress of the European College of Neuropsychopharmacology. So now they're messing with your brain, okay? This was accomplished with a favorable safety experience. The most common treatment emergent adverse events, dizziness and sleepiness, were roughly twice as common as with placebo in the 247 patient Hummingbird safety analysis. So they tested this on 247 people. So what would cause the FDA to approve of this is because a certain percentage of those 247 people found relief. But remember, the bodies don't adapt that quickly. So why things get approved through the FDA is they first look at the ingredients to make sure it isn't like super poisonous. But of course, if it was super poisonous, all their test subjects would be like decimated. So obviously they're going to do certain things and say, okay, well, we have a certain amount of this, certain amount of this, certain amount of this. And then we tested it on these certain people. There's placebos on this amount of people. And we're seeing these people are saying that they found relief, that, they have postpartum, they have PPD, they took this injection, they found relief. But remember, their body hasn't adapted to the poison yet. But wait, if they keep taking this, now, they say that, okay, so postpartum, we don't know how long, and some of you guys know how long postpartum lasts. It may last for like 3 months for some. It may last for 2 months. I don't know. I've never been pregnant, never had a postpartum issue, so I couldn't tell you, but you guys would know, for those of you who have been pregnant, maybe had PPD at some point, how long it lasted for you. So let's say for kicks that maybe somebody's postpartum would last for like 6 or 7 months right after they bared the baby. Well, you're taking this drug, okay, and you're trying to manage your postpartum depression. You're taking this drug, and then it stops working. You start seeing it stops working because your body adapts to the poison. So at first, yes, you upset homeostasis, you see relief, and then over time it wears off, and then you start seeing the side effects, okay? So let me keep reading here. Because of the urgent unmet need for an effective therapy for postpartum depression and early promising clinical trials results, brexanolone was developed under a breakthrough therapy designation by the Food and Drug Administration on December 19, 2018. The agency is expected to respond to Sage Therapeutics' application for marketing approval of intravenous brexanolone given as a continuous 60-hour infusion at 90 mcg/kg per hour. Wow, 60-hour infusion? According to Dr. Clemson, Senior Medical Director at Cambridge, Massachusetts-based Sage Therapeutics, which is developing the therapy. Postpartum drug is sleepiness, right. Brexanolone is a proprietary IV formulation of allopregnanolone, a metabolite of progesterone. So they're taking hormones and they're messing with your neurological situation here. So the drug's mechanisms of actions involves modulation of the neurotransmitter gamma aminobutyric acid, which is GABA. Okay, so what is GABA? Let's look at what is GABA real quick. So GABA is a hormone. It is an amino acid produced naturally in the brain. GABA functions as a neurotransmitter, facilitating communications among brain cells. GABA's big role in the bodies is to reduce the activity of neurons in the brain and central nervous system, which in turn has a broad range of effects on the body and mind, including increased relaxation, reduced stress, a more calm, balanced mood, alleviation of pain, and boost to sleep. So if you're having issues in your GABA and you're taking these drugs, it's because you have a hypo, what is it? A hypo, there's a name for that. What is that name for that? That's okay. Oh, hypofunction. Okay. So when you're sleepy, it's because your body's trying to repair from damage. So if I do my waterfalls and I eat like really bad food, I tend to get sleepy right afterwards. The reason why is because body's processing out those chemicals and those nasty stuff, and it's repairing the damage or trying to repair the damage. Okay. So anyways, let me get back to this. Okay. So brexanolone. All right. Go back up here. So GABA, the drug binds to, okay, so brexanolone is a proprietary IV formulation of allopregnanolone as a metabolite of progesterone. The drug's mechanism of action involves modulation of the neurotransmitter GABA. The drug binds to both synaptic and extrasynaptic GABA A receptors, thereby increasing receptor functionality. So it's trying to manipulate, because there is shown a decrease or an increase or whatever, the imbalance was causing PPD, okay, which is postpartum depression. So the decision to target GABA as a novel therapeutic strategy in PPD was based upon translational studies demonstrating that GABA is a chief neuroinhibitory mechanism in the brain, and its actions are mediated mainly by GABA A receptors. Brexanolone's efficacy is consistent with a theory that the pathogenesis of PPD involves triggers such as inflammation. Well, why is inflammation happening? Because inflammation is when the body is in contact with a pathogen. So there's something going on when you have PPD that's a pathogen that's affecting your brain. Remember, reproduction comes from mutations. When you have a child, your body is going to break down even more, okay? So hormonal fluctuations or chronic stress, which is some women's cause of GABA hypofunction, both at the receptors and in terms of tissue GABA level. So hypofunction is when there's too much hormones being created from the endocrine system, okay, which has a lot of hormones in it. And that also do with your thyroid too. So hypo, like hypothyroid type of stuff. Okay, so this in turn leads to an overactive HPA axis and dysregulated neural networks with resultant PPD, Dr. Clemson explained. So basically, when you have PPD, you have major hormonal fluctuations going on, okay? Right, not get enough rest and expect to be back. Right. That's true, Atara. Women are not getting enough rest, and then they're expected to be back to normal postpartum. Yeah, that's true. The 3 Hummingbird clinical trials were double-blind, randomized, and placebo-controlled. 2 were restricted to women with severe PPD. The third and large is focused on moderately affected patients as defined by baseline Hamilton Depression Scale for depression. HAM-D score of 20/25, whatever that means. The efficacy analysis includes 207 patients who received brexanolone at 90 mcg/kg per hour or placebo for 60 hours in an inpatient setting and were followed for 30 days. The primary endpoint was the change in HAM-D total score from baseline to 60 hours. The mean 17-point reduction in the active treatment arm was significantly better than the 12.8-point decrease with placebo. The between group difference was significant within the first 24 hours and remained so at all time points out to the study's end at day 30. There was no individual item on the HAM-D in which the drug performed worse than the placebo, and there were many in which brexanolone performed significantly better including depressed mood, anxiety, insomnia, and feelings of guilt. So, so in terms of rigorous secondary endpoint, HAM-D remission as defined by total score of 7 or less, the brexanolone injection significantly outperformed placebo at every time point except for day 30. There was a 2% rate of serious adverse events in both study arms. These included, oh my God, there's a 2% rate of serious adverse events in both study arms. These included suicidal ideation. Oh, so you're messing with somebody's hormones. You're messing with their neurotransmitters. They included suicide ideation and an intentional overdose attempt post-discharge, altered state of consciousness, and syncope. So they included an intentional overdose attempt post-discharge. Oh, so they tried to overdose on something. A vastly more convenient once-daily oral formulation of brexanolone is now in phase 3 clinical trials for PPD and major depressive disorder, and in phase 2 for insomnia and bipolar depression. Okay, so here's the thing. When bodies start adapting to these types of drugs where you're not going to see the relief and the curative benefits for a specific disease, this is when they're going to recall the drugs. When they see more people dealing with side effects than the benefits. So it's not like the FDA is killing you. No, it's a matter of at what point in time will the body adapt and then reap the consequences of you violating the laws. Whenever you take a drug, no matter what it is, and it'll tell you, the side effects when you read about the drug, whether it's Tylenol or brexanolone, and you read about the drugs and the side effects. And they don't even tell you all the side effects because your biochemistry is also going to come into play. And it's also going to tell you whether or not down the road you're going to be now creating another issue in your body, because they don't know the outcomes because they don't have all the biochemistries out there. I mean, they test on 247 people, but 247 people isn't like the cross section of the world. They're not getting everybody's biochemistry out there and testing it and seeing, okay, if we do this, what's going to happen if this happens? This scenario and this scenario. There's no way to know exactly how this drug is going to affect everybody out there with the different biochemistries and then different drug interactions and then lifestyle and belief system. So even though you may see the side effects on there and you're like, oh, wow, it really doesn't scratch the surface on the potential, what it could actually do in the future and what kind of diseases and mutations of diseases that are going to then be a consequence. See, that's the things that they're looking for short-term benefits. That's what it comes down to, short-term benefits. So what these biotech companies, whether it's natural remedies such as garlic or turmeric or honey, which also has side effects, which also will hurt you adversely, would also hurt the body over time. You don't know at what point when your body is going to adapt and then hold you accountable for violating the laws. Okay, so again, when you take a poison, no matter what it is, and that poison is strategic in trying to cure you of a specific issue, some people have very slow acting immune systems. Like they take a drug and the drug works on them, okay, and they get some kind of relief. But the body the immune system isn't working up to its fullest capacity, so it's not adapting very quickly. See, some of you are very slow adapters, so all these different drugs are going to work on you because your immune system is not working at its fullest capacity. It's not creating antibodies to go after that pathogen, and then the pain returns. Okay, I mean, and some of you have very quick adaptive immune systems to where you take in a drug and it doesn't work, and then you get the side effects because you can't escape violating the laws. Those side effects are basically other parts of your system now finally reaping the negative consequences because you violated the laws. You took on some kind of antibiotic acquisition type of protocol, whether it's turmeric and honey and garlic or some really heavy pharmaceutical grade prescription drug or even over-the-counter drug. You take in, just look at like what is it, like NyQuil, something that is so like popular like NyQuil. Look up the side effects of NyQuil. NyQuil side effects. And that probably won't even tell you exactly what you could be in for based upon your biochemistry. But at least they'll give you like what the general population experiences with these side effects. Okay, so you have drowsiness in the morning, dizziness, loss of appetite, stomach pain, vomiting. Let me see what else. NyQuil side effects. All right. Strange, disturbing, or very vivid dreams and nightmares. See, now you're messing with your hormones. Serious NyQuil side effects. And some of you have mutated bodies that you keep taking these specific drugs. The side effects and all of those negative experiences are going to even be like even more pronounced, even more severe, because your body, you have a lowered immune system, so you're not creating enough antibodies to go after the poison, and your body is slow to adapt and overcome and then try to push the poison out. So now you're mutating your body even more. Okay, so give me a second here. Rash. So these are severe side effects. Rash, swelling of the skin, hives, swelling of the tongue, lips, face, and mouth, tightness in the chest, difficulty breathing. Then there are severe cases, treatments of other diseases. Okay, there are several cases of disease about that. So, okay, so there are several diseases that are thought to have negative reactions when a person takes NyQuil. Some of these include renal or liver disease. Yeah, when you're taking in a poison, guess what? Your liver is not going to like having to go and try to clean that shit out. So you're going to get disease there. Gastrointestinal narrowing, diabetes, glaucoma, asthma, or COPD, heart disease. What else? Anticholinergic effects. So acetaminophen, which is one of the main ingredients in NyQuil, is primarily metabolized within the liver to inactive forms. However, small amounts are converted to metabolites by minor pathways, and then this could cause hepatotoxicity. Patients with hepatic impairments can be at increased risk of toxicity due to increased activity in the minor metabolic pathways. Severe liver injury, including cases resulting in liver transplants or death due to acute liver failure. See, and then and this is people are using acetaminophen. So the biggest ingredient in NyQuil is acetaminophen. It causes liver damage. It causes major damage to people who are already mutated, and then increased use of this stuff is going to then increase your chances of getting, diabetes, glaucoma, asthma, COPD. So if you're always getting sick and you're taking NyQuil, well, you're now creating a freaking tinderbox, a Pandora's box of shit that you don't want to deal with down the road. Pregnant women and new mothers that are breastfeeding should consult with the doctors before taking NyQuil. Breastfeeding is not recommended while taking NyQuil. Okay, and this is such a benign thing like NyQuil, and people take NyQuil like it's freaking, like it's water. They don't realize really what they're creating when they're taking NyQuil. Okay, and you don't know with your biochemistry how it's going to affect you. So even all of these specific issues like renal or liver disease, gastrointestinal narrowing, you take this over a period of time, you're not going to get those effects, the good effects, right, that they're claiming. That's why you're taking it. No, now your body is going to hold you accountable. It's going to hold you accountable for violating the laws. Okay, and then you're going to wonder why it is that you have sickle cell anemia, because you've exposed yourself to all these crazy pathogens and you're sustaining the mutations, my hair. And you're sustaining those mutations. And so all of your issues and your disease that you've been holding in your antibodies, because they're agglutinated, they come to surface and they trigger all these crazy diseases. And that's the same thing with natural remedies. When you're taking natural remedies, what are you doing? You're blocking the prostaglandin hormone. You're stopping the healing process. So when you stop the healing process from happening by taking anti-inflammatories, antivirals, antibiotics, whether it's natural or synthetic, your body is not healing. You're actually also poisoning it, so it's mutating even more. And then those antibiotics, the antibodies are chipping away at the weaknesses in every single aspect of your system. Then you start seeing aging happen. You're degrading. You're putting yourself more in favor of a possible heart attack, because you're the pathogens in your blood are agglutinating and thickening up in your blood, and that's what would cause a heart attack. And they could happen at any time, because when people in their 40s and 50s who don't fix the mutations and dilute those antibodies with good nutrition, they are ripe for a heart attack in our society. People are like, oh yeah, the guy was so healthy, and then all of a sudden he just died of a heart attack. Well, you'll wonder why. The signs were there. All of the signs were there. But every time you were sick, you take acetaminophen, you take Tylenol, you take this. Every time you're sick, you take NyQuil, you take Theraflu, you take all these different types of drugs, and it's compounding the issue. And then you're going to see, as you mutate even more and more and more, you're going to be the ones that are going to be dealing with the severe side effects of some of these benign drugs. See, the reason why some people can afford to take NyQuil, because they're young, they don't have as many mutations. But right now we're seeing that every generation has more and more mutations, because reproduction comes from mutations. So we're bearing kids in our world that came out of the gate already completely compromised. They already have juvenile cancers, Alzheimer's, diabetes, and then they're giving these kids like cannabis and all these anti-inflammatories and all these antibiotics and all these natural remedies. And so the kid doesn't ever heal. They never fix the mutation. And so when they think something is so like benign, like measles, and they don't get a vaccination, and they get something like the measles could kill them. So yeah, back in the 1960s, the measles wasn't a major deal. It was, but it wasn't. But they didn't have a measles vaccine. But guess what? The mutations compounding upon every generation, because we are reproducing on mutated bodies, warranted this vaccine schedule. No, the vaccine schedule didn't create this. It's people sticking their head in the sand, taking natural remedies, fasting, doing the honey and the turmeric and the kombucha, or they're doing the prescription drugs, doing all the immunotherapies that are circumventing the immune system, whether it's inhibiting a hormone or it's eliciting a hormone, causing imbalances. Because the three things that kill people is too much cancer candida, a hormonal imbalance, and too many antibodies. And when you do a titer test, all of you that think that you're so healthy, do a titer test, and you will see how unhealthy you are. You really are. Titer test, and actually I read somewhere that says like 4 out of 10 people are actually HIV, who actually have the HIV antibody. But why they don't come up with HIV positives, because those antibodies aren't like in numbers to where it would trigger a positive result on a test. When you go take a drug test, and let's say you smoke some pot, the reason why people would test positive is because those THC antibodies are very prevalent. And when you test negative on a test, it's not like those antibodies disappeared. No, they're not as prevalent. So they can tell when somebody's taken on a drug or a poison by counting the antibodies. How do they count the antibodies? Well, they have programs that do if-then. If the antibodies exceed this much parts per million or whatever their conditions for the test, it would then trigger a positive result. Or if they don't have enough count to trigger a positive result, then it would be a negative result. And sometimes it's inconclusive. When you guys get drug tests, or you get any kind of test where you test for antibodies, sometimes it's inconclusive. You're right out there on the verge of being positive and negative. Okay, so then they have to retest you again like another week or two later. That's how antibodies and tests work. So I'm sure everybody's been exposed to the AIDS antibody, whether you have the actual AIDS virus. I'm not going to test myself because I'm not going to worry about it, because I don't really care. I do my J juice, I dilute the antibodies, I fix the mutations, and I can afford a certain amount of antibody acquisition and not have it affect me adversely. But most of you, actually all of you out there that are watching me, can't afford the antibody acquisition, whether it's from natural remedies to then synthetic remedies and prescription drugs. So guess what? On your mutated body, those extra antibodies are going to then throw the balance off your body, mess with your hormones, chip away at your mutations, and then one day you have an event that you never expected, and you thought that you were so healthy, but no, you stuck your head in the sand trying to I don't know, thinking that you know everything. Okay, so but the reason why the FDA is there, the reason why biotech is here or is wherever, is because people are asking for shortcuts. When you actually educate yourself and your population around you, you won't be asking for these shortcuts, these poisons to poison your body to give you a temporary stay of execution. Because eventually when you violate the laws, you're going to be held accountable. Some people can get away with violating the laws. Like some of the people that these serial killers that finally get caught, or people that are cheating on their taxes, finally get caught, or when you're driving too fast all the time and you finally get caught. Well, it's because eventually when you are violating the laws, and it's statistical, too many times you violate the laws, eventually it's going to catch up to you and you will be held accountable for violating those laws. Well, that's exactly what goes on in humanity. The reason why you're dying is because you've been violating the laws for such a long time, and then you are held accountable. Death is a consequence. The reason why you're aging is because you keep violating the laws every single moment in time, trying to take shortcuts because you don't know any better. And it's not your fault. It really isn't. But now you have the access to information to understand that when there's an upset of homeostasis, that's when mutations happen. That's why antibodies get created. That's why the vaccine schedule is there, because you can't legislate morals. You can't make people eat healthy. You can't make people learn this stuff. So that's why we have the shortcuts out there, because people are not wanting to learn this stuff. So they want the shortcuts, and that's the role of the doctors. Okay, so when you have an upset of homeostasis, you get sick, and you're asking the doctor to give you some relief so you can go back to work, so you can make money until you die. Well, they're going to find a drug that's out there on the market to give to you and hope that it works. It may not work for you, but even if it does work, you only have a certain amount of time before it stops working and you have all these different side effects. And then is the drug really working? Because now you have like glaucoma, or you have some other type of side effect disease that you can take another drug for that's going to then deplete or destroy another system, and then you're on a string of drugs with all these different side effects. But that's no different than doing the holistic remedies. When you're on 50 million different supplements, which is basically poisons that induce hormones, because that's what vitamin A, B, C, D, E, and F, and G, those are all poisons that then elicit a hormone. Okay, they're synthetic. Okay, what is synthetic? It's a poison. It's using, like, let's say, like the natural thyroid medication. Guess what natural thyroid medication is? It's desiccated pig cells. When I was looking up the different thyroid medications people are using when their thyroid is missing and they have to go and supplement and get synthetic hormones, I'm looking at like, okay, well, if they can take a natural thyroid, then they don't even need the thyroid medication. Okay, if they just ate strategic nutrition or changed their diet, they could, well, potentially regrow their thyroid, but the body would then naturally create the thyroid hormone, or whatever that hormone is from the thyroid. And they wouldn't have to take desiccated pig cells or pig hormones, or when you're taking some kind of like PPD, or not PPD, birth control, you're not taking in a pregnant horse's hormones. That's what all these synthetic things are. But then taking something natural like garlic is a heavy metal. Okay, when you actually break down garlic to its chemical composition, it's actually heavy metals. So when you're taking in all these heavy metals and you already have a heavy metal accumulation, you already have mutations, you already have an imbalance, and now you're taking in more heavy metals, then that's going to cause even a more imbalance, and it's going to stop certain hormones from working. It's going to kill the good bacteria in your gut. You're not going to be healing, and you're going to be aging and then contracting cancer, disease, and chronic illness and sudden events that you're not expecting. No different than taking these detoxes like zeolite. It's aluminum silicate. Bentonite clay, it's aluminum silicate. What's aluminum? Aluminum is a heavy metal. When you're doing orgonite, when you're taking orgonite into your house, which is all of the new, revolutionary way to clean the air from the Wi-Fi, right? No, when you're trying to clear Wi-Fi with another heavy metal, it's no different than taking aluminum silicate into your body. Orgonite is like taking in heavy metals in your body to deal with heavy metals. It's like the Andy Cutler's chelating heavy metals out of your body. He's giving you all of these types of poisons and a bunch of supplements to then chelate all of these heavy metals, when actually he's compounding the issue. And he's aging. Look at Andy Cutler. He is aging. Look at Rick Simpson and the whole cannabis stuff. He is aging. You really want to end up like those guys because you're trying to detox something using the same elements that are causing the imbalance in your body? Okay, so everything has to be broken down to the periodic tables. It's broken down to a chemical composition. It's broken down to science. And then what is the point of cells? when cells divide and when cells reproduce. The cells divide because there is it's growth. What are you growing? Are you growing cancer cells? Or are you going to grow good cells like a baby that's developing? Or when you're regenerating cells because you're using strategic nutrition, you're developing and you're multiplying good cells. But you can multiply bad cells too, like cancer cells. What are cancer cells? It's yeast. Yeast in your body. You need yeast in your body, but when it becomes imbalanced, it multiplies very rapidly. You have to have a balancing force to counter it. And that's where the antibodies and that's where the hormones come into play. But then you utilize those things to balance each other out. You can cause an imbalance in of itself. So you need an outside force like strategic nutrition to balance everything out. Okay? So that's like the cancer and oh my God. What else? I mean, cancer, yeast cells. Oh yeah, why do cells reproduce? Okay, well, cells reproduce and make copies because there's a mutation. Why do we have chromosomal deficiencies or malfunctions where we're having copies of chromosomes? Because there's a mutation in this chromosome of like 400 genes. And so autophagy isn't being triggered, and autophagy is a disassembling of a mutated cell, which it purges it out of the body. And that's where the calcineurin hormone comes into play, where it purges it out. That's why you lose teeth that are rotting, or you're losing, the skin that's bad. Okay, so when you're not inducing autophagy, you're keeping the mutations in your body. So when you have a chromosome disorder or a mutation, the body then creates another copy of that chromosome. That's where the Down syndrome comes into play, but they're still keeping that mutated chromosome that should have been purged. Oh no, and so that's where then the person is disabled. They are Down syndrome, or they can't speak, or something else. So that's why, that's where reproduction comes from. It comes from mutation. So reproduction in the human population, as far as having babies, is no different than a cell that's trying to reproduce because of a mutation. Cells don't just reproduce out of nowhere. It's triggered by an event. What's that event? It's a mutation. It's an upset of homeostasis somewhere. When you get hit by some kind of gas and you see like welts on your body, that's a mutation. And then autophagy kicks in and purges out the bad cells, and it allows you, in the right circumstance, in the right conditions, to then regrow those cells to then heal your skin. So when you cut your hand, when I showed on Dr. Phil, when you cut your hand and you see your skin cells regenerating, that's autophagy, and that's cell regeneration at a very superficial level. And skin is the largest organ. So yeah, you can regrow your organs. You can regrow your limbs. Already Harvard has said that you can do it. They just don't have the formula that they can sell you to do it, because pain would have to be involved. Okay. And big pharma and biotech and the doctors know that you guys don't want pain. Not all of you, but some of you who are watching me, they're not doing the J juice. You don't want pain. You're going to take every single painkiller out there. You're going to take every single thing that's going to stop the right hormones from working. And then guess what? You're going to be aging, and you're going to trigger some kind of event that you're not even expecting. And at this point, at this day and age, the way our system is going, people are triggering events at an earlier and earlier and earlier age. 50 now seems to be like the magic number for those that are on that death trajectory at this point in our society. It seems to be the age where you're going to be like, whoa, what's going to happen? I'm starting to see things that are going to be, triggers to where you don't know if it's going to be a heart attack, a stroke, or an aneurysm. People are already seeing aneurysms at an earlier age. People already had heart attacks at an earlier age. Okay? It's so, why wait? Why roll the dice? Why not understand Jilly Juice? Because Jilly Juice really is that strategic form of nutrition that, yes, you're going to have to experience the pain. No, I mean, you're not going to be focusing so much on the painkillers, but some of you are so mutated that, yes, you're going to have to balance out the painkillers and balance out J juice so you can still function on a day-to-day level. Okay, and that's something that you're going to have to figure out. Some of you are so mutated that you're going to have to let your doctor know what you're doing. And some of you won't be able to survive this. Some of you won't be able to do the J juice because you won't be able to handle the pain. If you're in hospice, yeah, there's no freaking way, unless you have a very amazing support system to help you through And when you're in hospice, you're already, the system can't even help you. The reason why people are in hospice is because they have so many mutations, so many antibodies in their body, they can't afford another antibody acquisition protocol, because that's what the system only plays with. That's what they only give you, antibody acquisitions or immunotherapies. They circumvent the immune system. They either inhibit a certain hormone or they release a certain hormone, and then it will cause an imbalance, and it will cause an increased antibody count. Anytime you circumvent your body's natural processes, the laws, or anytime that you violate the laws of your body, you will then have more mutations. So when you're in hospice, the system can't do anything for you. Mexico and their cannabis stuff can't do anything for you. The Gerson method can't do anything for you. Nobody can do anything for you except good nutrition, but you have to deal with the pain. So when you're in hospice, you're in so much pain because the body is so trying to survive, and you're not giving it what it needs. And so you keep taking these painkillers and painkillers and painkillers until you die. So all I'm trying to do is help you guys not get to the point of hospice, or even to the point of where you're even like 2 or 3 sections away from hospice, when you're in palliative care. Because there's, you don't have a choice of how you leave this world. Some of you will have an event where you might be half paralyzed. Oh, that's joyful. Half paralysis. You really want to deal with half paralysis in your life? To now you can't even go outside. You're stuck at home. You can't go and fix your CB radio or fix your car or fix this or fix that. Oh no. You're now stuck at home having somebody wipe your ass. Okay? If you are not doing even a little bit of Jilly Juice every so often to kind of like give you some nutrition to fix some mutations, because let me tell you, when you do Jilly Juice, it's going to fix the most severe situation that you have. Now, it's not going to fix everything, but it's at least probably going to go after the most severe that would then probably trigger into your death. So when you do Jilly Juice, hey, Carolyn, when you do Jilly Juice, you're going to find what the body is going to prioritize first. And if you get a headache on Jilly Juice, it means that you have some major issues go on in your brain, in your neurological system, that needs to get fixed first, because that's probably what's going to take you out first. See, that's interesting. I didn't really realize that, but yeah, when I first did, I forget what exactly my first symptom, but I know I had major headaches, and I know I had a lot of yeast. I had a lot of yeast infections when I did this. When I first did this, a lot of yeast infections. So that was probably what I would probably been coming down with, is like some kind of lymphoma or some kind of like cervical cancer, because I had major yeast infections in the beginning, major. And I had those when I was in 19 or 20. I was taking like, Monostat 7 all the time in my early 20s. So yeah, when you first do J Juice and you start seeing symptoms happen, you pay attention to where they happen first. Most likely that's what would probably be the one to take you out in the end, if you keep going on this trajectory, because the body is going to prioritize what is the most severe, as far as the severe case in your body, as far as, sickness. Okay. So really, you have to do the strategic nutrition, because if life is precious. Death should not happen. Death shouldn't happen, but it only happens because people violate the laws. When people violate the laws, death happens. And then when you see red flags, when you start seeing, you have skin conditions, you have headaches, you have, weaknesses, and you don't have the range of motion, you have back issues, you have balding issues, you're going gray, you see mutations, those are major signs. Okay, and what's so lucky about the human body is that when you see these things happen, you have time to reverse those situations. You have so many cells in your body that, unless, you have a major mutation to where it just completely like destroys one of your vital organs, you have recourse. Okay? You have recourse. So, let those signs, those mutations that you see, let those be like precious gold of messages of information for you to now finally change the trajectory of your life. If you keep ignoring those red flags, there is no telling, because you don't know the state of your heart. You don't know the state of your brain. Especially if you drink the J juice and you get immediate headaches, it means you have some issues with your brain. Okay, you have issues with your neurological system. That means that some people die from strokes. The fact that lady on Dr. Phil had a healing symptom in her brain or her heart, whatever the two, it shows that's probably what she would have died from if she hadn't done J juice. She probably healed a little bit, and that's why she had that experience of healing. So I probably bought her, maybe, I can't tell how many years I bought her, but I'm sure I bought her a few years, but she's probably back on her old regimen that she probably will die at some point. It sucks, but that's the trajectory most people are on that don't understand how the human body works. That you get so many chances. Every single time you have an event, that's a chance for you to go one direction or go the other direction. You can take the life trajectory or take the death trajectory. And when you take the death trajectory, you can't tell when you're going to die. You're not going to know. And every single event is telling you, okay, come on, there's a problem here. Fix the freaking problem. Oh no, I'm going to take a pill. Oh, I'm going to go get this taken out. And you're going to cause more mutations. When kids get their tonsils out, guess what? They're stopping now. They're not, that's like their first line of defense. And Kevin has something about the tonsils. But now, you know, when you get tonsils out, when you get organs removed, you get things removed out of your body, now your body's at a more of a disadvantage. Okay? So prescription drugs and holistic natural ways, as far as remedies and plant therapies, run the other way. The only time those are any good is if you're in imminent danger. When you're in imminent danger. Therapy is something to where it's like a long period of time, which means that you're basically practicing in the art of paving the way for your death. That's what therapy is. Okay, so when you're in plant therapy, you are putting in brick by brick your death trajectory. That's what therapy is. So any type of therapy, watch out for, because it's a state of action. You have to be in imminent danger for you to use any type of these things. You really have to. If you're not in imminent danger, then you don't need to do all those therapies that are out there, whatever they are. You need to change your perspective on your body and understand that you're not supposed to die, but you're dying because you're violating the laws of your body. And Kevin's right. B12 shots are horrible. Anything that's like vitamins A, B, C, D, those are all poisons that then trigger hormones. It causes an imbalance. Okay? Get away from the supplements. Those are poisons. And every single naturopathic, homeopathic out there, they deal with poisons. Okay, just because it's not FDA approved doesn't mean it's better for you. FDA approval means that, yeah, you're dealing with a more severe poison and they have to do all this testing. But if it's not FDA approved and it's sold in your holistic store, it may not be as severe, but hey, hold on a second. You know, is taking small amounts of arsenic over a period of time so much better than taking a large amount of arsenic, like right off the bat? I mean, you die now or die later. What's the point? Why even die at all? See, that's how the holistic world is able to sell you guys on the THC and the cannabis and all that stuff, because it's all about temporary states of execution, and they're banking on that you can afford to take on some of these antibody acquisitions. If you're not actively regenerating your cells and actively reversing your mutations, and you're 100%, if you're not doing that, then you are accumulating antibodies, accumulating mutations, accumulating poisons, and then you will have an event that you will not even anticipate, because it'll happen that quick. Because you're not actively, you're not looking at your heart, you're not looking at your brain, you're not looking at anything and seeing, oh yeah, can I afford to take on that antibody today? I mean, that's how you have to look at it. Can you afford to walk out of your house today? Some of you can and some of you cannot. And then some of you are breaking down. And your attitude show, your mental shows, everything shows. Your physical health shows. You know, don't think that you're better because you're able to work on your pain. No, you really got to deal with that. You got to reverse it, but I don't think I can say to do it. You know that. All right. That's it, guys. I just want you to know that that's how the pharmaceutical, so the FDA isn't bad. They're just giving you guys what you want, but they're trying to regulate to make sure that the drug makers don't completely kill you. And the drug makers don't want to kill off their customer base either. But they're trying to capitalize, you know, on that. They want to capitalize the time that your body doesn't adapt to these drugs. And then when your body adapts to those drugs, that's when the side effects start happening. And sometimes the side effects happen faster and then the drug doesn't work, or the drug works and the side effect still happens. And so now you're dealing with two different issues now. Now you're dealing with managing your specific disease with this drug, and you're dealing with the side effects because the body, you know, you're not going to escape the consequences of poisoning your body. Okay? So now you got to deal with two things at once versus one thing, and then maybe down the road you might have this specific issue. But why even go there? Why? But then, yeah, some of you can't right now, well, some of you can afford to do this. You just have to figure out and plan your time out. It's called planning. My hair looks horrible right now. Okay. All right. That's all I have. Go to jillyjuice.com. Okay. JILLYJUICE.com. Get the book. Read it. Understand it. Realize that the way you're going, if you're not doing Jilly Juice, you are building your death process brick by brick. And some of you have elicited a bunch of people to help you build your death process. And now you have a whole crew getting you faster to your mortality. You really don't want that. You need to slow down and then stop the death process. Stop the aging process. The aging process is your body finally holding you accountable for all of your violations. Death is a mutation. Death is a consequence. Okay? All right. Bye.